Hello everyone, welcome back to our second recall session of PG entrance examinations. Today I am going to discuss anatomy recall questions of AIIMS-PG that is conducted in 2018. So let us start the discussion of recall. So the first question is the structure marked with the asterisk in the electron micrograph indicates. See guys, this is the asterisk, this is the arrowhead. So let us label first of all this electron micrography picture. This asterisk is secretory vesicles. This arrowhead is showing postsynaptic density, and these are all the postsynaptic cells. So according to this labeling, the asterisk is showing the secretory vesicles. So the answer is C. Now let us move on to the second question. Inferior thyroid artery is the branch of which of the following? See guys, when somebody asks the branch of artery or a different vessel or particular vessel, you must have to know a figure of that region blood supply. For example, blood supply in the region of neck. And you have to uh, remember those figures of arterial supply, nerve supply, different triangles that can be formed in the region, artery and nerve relationships, so that you can answer this kind of question very easily in a better way. These questions can become a cakewalk for you. So for answering this kind of question, let us see what is the arterial supply of neck. So this figure that you should have to remember to solve this question. This one is inferior thyroid artery. So this figure is directly telling that inferior thyroid artery is the direct branch of thyrocervical trunk. There are another two branches, that is transverse cervical artery and suprascapular artery. These both also the arterial supply that originated from the thyrocervical trunk. So this figure is very important to solve this question. So the answer is C, thyrocervical trunk. Neurovascular bundle is absent in which compartment of the leg? The options are lateral compartment, posterior superficial compartment, posterior deep compartment, and anterior compartment. Let us see what are the different vessels and nerve present in each compartment. Lateral compartment is having superficial peroneal nerve, which sometimes you can refer as a fibular nerve, and superficial peroneal vessels. Posterior deep compartment is related with posterior tibial nerve and posterior tibial vessels. An anterior compartment is related with deep peroneal nerve and anterior tibial vessels. Posterior superficial compartment is not having any kind of neurovascular bundle. So the answer is B, posterior superficial compartment. Now move on to the next question. A patient presents to you with inability to form words but can make noises. He also knows what he wants to say. What area of the brain has been damaged in this patient? So the patient has absence of speech. According to this question, because there is inability to form words but can make noises. So the Broca's area of speech is likely to be affected in this patient. The answer is B. Question number 5. Identify the wrongly marked structure in the diaphragm. So first of all, label these all four structure. A is corpus callosum. B is fornix. C is posterior pituitary gland. D is cerebellum. So the answer here is wrongly marked structure is C, hypothalamus, because it is the posterior pituitary gland. Loss of flexion at interphalangeal joint of thumb after supracondylar fracture is due to the involvement of. There are two main type of joints in the thumb. The first one is interphalangeal joint and the second one is metacarpophalangeal joint. So metacarpophalangeal joint has flexor pollicis brevis and interphalangeal joint has flexor pollicis longus muscle attached. Flexor pollicis longus is supplied by anterior interosseous nerve, which is the branch of median nerve, and flexor pollicis brevis is supplied by recurrent motor branch of median nerve. So the interphalangeal joint of thumb action is mainly done by flexor pollicis longus and it is supplied by anterior interosseous nerve. So the answer is D. Purkinje cells of cerebellum relay into. So caudate and lentiform nucleus, this both given option are the basal ganglia nucleus Actually, Purkinje cells of cerebellum relay into the deep nucleus of cerebellum. So the option given below, the answer mostly is dentate nucleus because dentate nucleus is the only nucleus of deep cerebellum or which is located in the deep cerebellum. Red nucleus is nothing but the having the afferent from cerebellum and which signals to the cerebral cortex. Now move on to the next question. Which of the following sensations is not perceived by the spinal nucleus of trigeminal nerve? So for answer to this kind of question of nucleus of any kind of nerve or any cranial nerves, you must have to know the each and every nucleus function of that particular nerve. So let us know the or learn the table of location and function of different nucleuses of trigeminal nerve. The first nucleus is mesencephalic nucleus. Mesencephalic nucleus is composed of column of unipolar nerve cells, which are situated in the midbrain and extends inferiorly into the pons as far as the main sensory nucleus. Mesencephalic nucleus receives the sensation of proprioception. So this is the function of mesencephalic nucleus, proprioception, from the muscles of mastication and from the facial and extraocular muscles. The second one is principal sensory nucleus located in the posterior part of pons lateral to the motor nucleus and receives the sensation of touch and pressure from the face. The third nucleus is spinal nucleus, which is continuous superiorly to the main sensory nucleus and extend inferiorly wall of the medulla oblongata till the second cervical segment and receive the sensation of pain and temperature from the face and some fibers of touch. So spinal nucleus is responsible for the receiving the sensation of pain and temperature as well as some fiber of touch. So touch, pain and temperature is the function of spinal nucleus of trigeminal nerve. The last nucleus is motor nucleus. Motor nucleus is located in the pons medial to the main sensory nucleus as well as it supplies the muscles of mastication, tensor tympani and tensor villi palatini, mylohyoid and anterior belly of digastric muscles. So these nucleus is a function of supplying the muscles or muscles of mastication. So now it is a very simple and straightforward question. Which of the following sensation is not perceived by spinal nucleus of trigeminal nerve? As we have discussed, temperature, pain and touch. This is the principal function of a spinal nucleus of trigeminal nerve, but the proprioception is perceived by the mesencephalic nucleus of trigeminal nerve. So this kind of question and the answer of this kind of question can be remembered by only and only you have to learn and you have to remember the different functions of different nucleuses of cranial nerves. So let us move on to the next question. The structure marked in the given picture arises from the. So this one is the fornix. Very simple and straightforward question. Fornix arises from hippocampus and fornix ends in the mammillary body, the thalamic nuclei of the mammillary body. So the origin of fornix is B. Hippocampus. Which of the following arteries does not supply the corresponding region of the dura mater? So this kind of question you can answer easily from the arterial supply of different cranial fossa. So you have to remember one more table to answer this kind of question. So the first cranial fossa is anterior cranial fossa. The anterior cranial fossa blood supply is meningeal branches of anterior and posterior ethmoidal arteries, meningeal branches of the internal carotid arteries, and a branch of middle meningeal artery. So these three are the blood supply of anterior cranial fossa. Now let us discuss about the blood supply of middle cranial fossa. This is middle meningeal artery and accessory meningeal branches of the maxillary artery. This is the first blood supply. The second one is a branch of the ascending pharyngeal artery. The second blood supply is a branch of the ascending pharyngeal artery. The third one is branch of the internal carotid artery. And the fourth one is a recurrent branch of lacrimal artery. The last cranial fossa, that is a posterior cranial fossa, the blood supply is meningeal branches of the occipital artery, posterior meningeal branches of the vertebral artery, deep meningeal and tentorial branches arising from the meningohypophyseal trunk. Let us repeat this once again because, guys, neuroanatomy and blood supply of the cranial fossa is one of the most important topics of discussion. So, the anterior cranial fossa blood supply is meningeal branches of anterior and posterior ethmoidal arteries, meningeal branches of the internal carotid arteries, and a branch of the middle meningeal artery. Middle cranial fossa blood supply is middle meningeal artery and accessory meningeal branches of the maxillary artery, a branch of the ascending pharyngeal artery, branch of the internal carotid artery, and a recurrent branch of the lacrimal artery. Posterior cranial fossa blood supply is meningeal branches of the occipital artery, posterior meningeal branches of the vertebral artery, deep meningeal and tentorial branches arising from the meningohypophyseal trunk. So with this, we have to remember these all blood supplies of different part of the cranial fossa, that is anterior, middle, and posterior. So now this kind of question becomes the easy. Middle meningeal artery is the blood supply of anterior cranial fossa. This one is true. The next one is accessory meningeal branches of the maxillary artery supplies middle cranial fossa. This one is true. Meningeal branch of internal carotid artery supplies posterior cranial fossa. This one is wrong because middle cranial fossa supplied by meningeal branch of internal carotid artery. The last one is meningeal branch of anterior and posterior ethmoidal artery supplies anterior cranial fossa. This one is completely true. So the answer is C because this is the wrong match. This is not the correct one. Let us move on to the next question. All of the following take part in the formation of wrist joint except scaphoid, yes. Triquetrum, yes. Distal end of radius, yes. Distal end of ulna does not take part in the formation of wrist joint. So the answer is D. Which of the following nerves is not involved in olfaction? See, trigeminal nerve, vagus nerve, and glossopharyngeal nerve. These three are mixed nerve. And hypoglossal nerve is purely motor nerve. It does not involve in olfaction. Answer is D. Hypoglossal nerve. Which of the following is the most conspicuous sign of breast cancer? Means that sign that clearly indicates that it is a case of breast cancer. That is known as most conspicuous sign. So that is only one, Paudi Orange. Identify the cranial nerve that passes through the marked foramen in the image below. This is nothing but the superior orbital fissure and cranial nerve that passed third and sixth. So oculomotor nerve, that is the third cranial nerve that passes through superior orbital fissure. Which of the following vein drain into brachiocephalic vein? Again, I am telling you, the vascular supply, the vein supply, the nerve supply, the diagram are very important. So if you know the diagram of vena cava, tributaries of vena cava, azygous vein, hemiazygous vein, then it is a simple and straightforward question. And the answer is D. Left superior intercostal vein. It is very simple and straightforward question, directly factual based. You have to know the figure. Azygous vein, hemiazygous vein, and intercostal veins. Next question is, what is the main action of the muscle marked below? The muscle is temporalis. And what is the function of temporalis? Elevation of the mandible joint when you open the jaw or at the movement of jaw. So the answer is A, elevation. Ligamentum flavum has high level of type 1 collagen, type 2 collagen, reticular fiber, elastin fiber. This is a simple, straightforward, directly factual based question. That ligamentum flavum, ligaments has the highest amount of elastin fibers than anything else. Type 1 collagen, bones are mostly. Type 2 collagen, cartilages. Reticular fiber are present in reticuloendothelial tissues and different soft tissue structures. But elastin fibers is a maximum level in ligamentum flavum. Which muscle is not involved in the inversion of foot? Completely true, that is peroneus longus. Because tibial is anterior, what is the function? Dorsiflexion and inversion. Tibial is posterior, plantar flexion inversion. External hallucis is longus, flexion of great toe and inversion. Peroneus longus function, plantar flexion and eversion. So it is not involved in inversion of the foot. Which of the following is normally seen in lumbar spine? C. Cervical spine, lordosis. Thoracic spine, kyphosis. Lumbar spine, lordosis. So the answer is C. Lordosis. Recurvatum is mostly seen in pelvis. Anteroinferior recurvature is seen. Type 1 collagen is not seen in bone, yes. Ligament. Aponeurosis, yes. Elastic cartilage. Remember the cartilage. Mnemonic or the name itself suggests cartilages. Type 2 collagen. The correct pair of lymph node level in the neck and anatomical boundaries among the following are. See, this kind of question you have to answer. But what is the easiest way to answer this kind of question? So the easiest way is by knowing the different figures and different levels at which the lymph node names and lymph nodes are situated in different regions. When they ask about lymph node in the neck, lymph node in the thigh, lymph node in the abdomen. So this time they have asked the lymph node in the neck and level boundaries of that level, that is asked in this question. So let us discuss about levels of lymph node in the neck in the lateral view. So 1A is a submental lymph node. 1B from this figure is submandibular lymph node. 2 is upper jugular, 3 is middle jugular, fourth one is lower jugular lymph node. Fifth one is posterior triangle lymph node, which is divided by cricoid cartilage into 5A and 5B. Sixth one is anterior group of lymph node, and seventh one is mediastinal lymph node, which is situated in the mediastinum. So let us answer this question from this figure. Level 3 is cricoid to clavicle. This is wrong. See, the question asked about identify the correct pair. So we have to identify the correct pair from these all four options. Level 3 is actually from hyoid to cricoid according to this figure. See guys, you have to know the figure exactly to answer this kind of question. Then only this kind of question becomes a cakewalk for you. Level number 4 is hyoid to cricoid. No. Hyoid to cricoid is level number 3. Level number 5 is base of skull to cricoid. This is again wrong statement. And level number 6 is hyoid to clavicle. This is completely true because level number 6 is situated from hyoid to clavicle in this figure. To answer this kind of question correctly and effectively, we must have to know all kind of anatomical boundaries and figures by heart. Then only we can read the option and then only this kind of question becomes a cakewalk for us. Move on to the next question. Meissner's corpuscles are present in straightforward and factual question. The answer is papillary dermis. So with this, we concludes the our second recall session of Anatomy AIIMS-PG 2018. See guys, we have discussed this whole recall and we came to know the conclusion that we have to know the different blood supply, nerve supply, different anatomical figures which are frequently asked in the examination because previous year questions are the gold standard to know any kind of previous year topics as well as to know the topics which we have to more focus on. So with this we complete our session. Thank you so much for watching and see you in the next one.